Farm 200. Let's go ahead and do week 2 online A. So this is going to be a review of last week. So SIG codes 1 and SIG codes 2. So in SIG codes 3, we'll take a look at some sample prescriptions. So take a look at these if you have any questions. But let's go over these guys. They should be mostly review. So what's the verb for IV? In the verb infuse, right? So this is going to be infuse 2 liters intravenously around the clock. So what's important about online A for week 2 is the EDS calculations. We're going to do some EDS and other math calculations. All right, number 2, PO. What's the verb? Take. All right, so very good. So here we got DR, which are drams. So what's the household units? Teaspoons, yeah. So dram, 1 dram is a teaspoon. So here we got 2 of them. So we're gonna take 2 teaspoons full by mouth 3 times a day before meals as directed. So take 2 teaspoons full by mouth 3 times a day before meals as directed for number 2. For number 3, we got to look at both the route rectally and the dosage form. So what's the verb for suppositories? Yeah, very good. So make sure you unwrap and insert. So we'll unwrap and insert 1 suppository into the rectum every 4 hours as needed for pain. Unwrap and insert 1 suppository into the rectum every 4 hours as needed for pain. All right, we got another parental route, IM. What is the verb for into the muscle? Inject, very good. So we're going to inject, and anything that is parental IV route, we can just leave the units. So we'll inject 5 milligrams into the muscle every 4 hours as needed for pain. Inject 5 milligrams into the muscle every 4 hours as needed for pain. Number 5, very similar to the previous one, but this time it's going to be 1 to 2 suppositories. So remember, we always start off with the correct verb. So what's the verb again? Yep. Unwrap and insert 1 to 2 suppositories into the rectum 3 times a day after meals as needed for nausea and vomiting. So if you have nausea and vomiting, you most likely won't be able to swallow your medication, so they'll use an alternative route. Unwrap and insert 1 to 2 suppositories into the rectum 3 times a day after meals as needed for nausea and vomiting. So they can do up to 6 in a day. Number 6, PO, for us that's always going to be take. C is a capsule. Sometimes they'll abbreviate CAP. So in this one, we'll take 1 capsule by mouth every night at bedtime as needed. MRX stands for may repeat, and then the number tells you how many doses. So in this case, may repeat once, or may repeat 1 dose. Take 1 capsule by mouth every night at bedtime as needed. may repeat 1 dose. So most likely a sleep aid. If it doesn't work, you might be able to take a 2nd dose. Number 7, same capsules. This time it's every 12 hours UG. So we'll take 1 capsule by mouth every 12 hours until gone. So very good. There's no such thing as until done. So UD is always going to be as directed. UG is until gone. Take 1 capsule by mouth every 12 hours until gone. So they'll take 2 capsules in a day. Number 8, SL. That's going to be under the tongue. It stands for sublingual, but for patients, we want to make sure we use easy, simple English. So we'll place 1 tablet under the tongue every 5 minutes as needed for chest pain. May repeat 2 doses. And this is very common for nitroglycerin sublingual tablets for angina, chest pain. Place 1 tablet under the tongue every 5 minutes as needed for chest pain. May repeat 2 doses. So after the initial and 2 more, if there's no relief, usually you'll need to call 911. Number 9, PO we'll take. So we'll take 2 tablets by mouth every morning and 1 tablet every night at bedtime. So how many tablets would they take in a day? How many in one day? 3, yeah. So 2 in the morning, 1 at night, for a total of 3. So take 2 tablets by mouth every morning and 1 tablet every night at bedtime. So anytime you see an and, that means to add. So we'll take the 2 and we'll add it to the 1 at night for 3 in a day. Number 10, we got 1 ounce. How many mLs is 1 ounce? 30, right? So in household units, how many spoons are there? 2 big ones, yeah. So we'll use the easiest household units. So a tablespoon is 15, an ounce is 30, so that would be 2 tablespoons full. So take 2 tablespoons full by mouth 2 times a day with meals. Take 2 tablespoons full by mouth 2 times a day with meals. So we had AM, PM, so AC, PC. So A comes before P. So AC is before meals, PC is after meals, and this C is just with meals. 11. So this degree sign is not a degree sign. It stands for hour. So this is going to be 1 hour. So IVP is IV push. What is the verb for IV push? Inject. Very good. So don't mistake that with IV piggyback. They're both different. IV push, IV piggyback. So we're going to inject 10 mLs, intravenous push, 1 hour after meals as needed. So this is usually an acid medication, probably protein pump inhibitor. Inject 10 mLs, intravenous push, 1 hour after meals as needed. We got ointment affected area, and it looks like an eye. Which eye is it? Left or right, or both? Right. So good. So if you recall, think San Diego, SD. So S on the left, D on the right. And if you speak Spanish, how do you say right in Spanish? Yeah. So starts with a D. So this is going to be the eyes. Just think of ojos if you speak Spanish. So we're going to apply ointment to the affected area of the right eye 3 times a day as directed. So for us in class, we're going to assume that they use 1 gram per dose to make our EDS calculations easier. Apply ointment to the affected area of the right eye 3 times a day as directed. Number 13. So there's multiple ways to decipher this. So to differentiate this from tablets vaginally, we're going to use apply. So we're going to apply the contents of the applicator. So in this case, SS is how much? Half. So we're going to apply 1/2 applicator full vaginally every 12 hours for 7 days. Apply 1/2 applicators full vaginally every 12 hours for 7 days. All right, 14. We got 15 to 30. So that's going to be big spoons, 1 to 2 big spoons by mouth. So take. So we're going to take 1 to 2 tablespoons full by mouth 3 times a day before meals and every night at bedtime. So how many total doses are they taking? 4, right? So they're taking 3 plus 1 more at night. So a total of 4 doses. So they're going to take 1 to 2 tablespoons full by mouth 3 times a day before meals and every night at bedtime. So that's going to be 30 mLs up to 4 times. So in a day they can use up to 30 times 4, which is 120 mLs. 15, what's a cc? That's an ml, right? A cc is an ml. So cc is not acceptable on notation or abbreviation for cubic centimeter. We got to convert all cc's to mLs. So IVP, we are going to inject 2 mLs. Intravenous push, stat means immediately or now. So inject 2 mLs intravenous push now. $16. So we got PO again. So that's just take. We're going to take 1 to 2 tablets by mouth every 4 to 6 hours. What's PPA? Yeah. So that's another way for abbreviating as needed for pain. Take 1 to 2 tablets by mouth every 4 to 6 hours as needed for pain. So in one day, a 24-hour period, how many tablets can they take? What's the maximum that they can take here? 8? So what's more, 1 or 2? 2, right? So what gives you more doses? Every 4 hours or every 6 hours? How many doses do you get every 4 hours? 24 divided by 4 is 6 doses, right? So I can take 2 6 times. So in a day you can take up to 12, right? So always go with the most number of doses. So you were kind of correct guessing. Let's go with the most number of hours. What do you want to go with the doses? So 2, 6 times for a total of up to 12 in a day. All right, so that's very important. We need to figure out the per day amount, the maximum amount of drug that the patient will use in a day. So that's EDS, estimated days supply. So in this question, if we gave the patient 60 tablets and they followed this regimen, how many days would that last? Right? So how many was dispensed? 60. And then we figured out previously, if they take 2 tablets up to 6 times, how many is that in a day? 12. So take 60, the amount you dispense, divided by the 12 that they can take in a day, and that'll let you know how many days 60 tablets would last. So when would they come back for a refill? After how many days? 5 days, yeah. Do 60 divided by 12. So they would finish up at the end of 5 days, so they should come back on day 6 or so, right? So that's the importance of EDS. That triggers the reorder point, when we expect the patient to come back for a refill. So you just take the amount dispensed divided by the maximum that they can take in a day. And if there's ever a fraction of a day, just round down to the nearest day. Okay, number 18. So we got big spoon or small spoon here? Small spoon. So PO, we're going to take 1 teaspoonful by mouth 4 times a day as directed for 10 days. Take 1 teaspoonful by mouth 4 times a day as directed for 10 days. Are you guys starting to get the flow? Right? So the most important thing is the verb. And then a lot of times what we'll forget is the route. Right? The 2 most important things, the verb and the route. All right, for number 19, we're kind of doing the opposite of EDS. So in this case, the doctor gave us the EDS. The doctor says 10 days supply. So he gave us EDS. And what the doctor wants us to do is figure out how much to give the patient based on the SIG. So the SIG is 1 teaspoonful by mouth 4 times a day for 10 days. So how many mLs of drug would they need for 10 days worth? So all you do is you take the 5 mLs, multiply it by 4 doses in a day, and then multiply it by 10 days. So what is 5 times 4 times 10? What do you guys get? Punch it in. 5 times 4 times 10. Do it in your head if you can. 200, yeah. So in this case, the doctor wants us to figure it out. Pharmacy to QS. So we figured out that we will need 200 mLs. So all you need to do is put in 200. You don't need the units. So the units are always in the question. So just the numerical value, 200. So just how many mLs per dose times how many doses in a day for how many days. Number 20. What is IVPB? Piggyback. Piggyback, right? So don't get that mistaken with IV push. So IV piggyback, is that infuse or inject? Infuse, very good. So we're going to infuse 250 mLs intravenous piggyback over 3 hours every 6 hours. So the overtime, that's the infusion rate. The Q6H time, that is the frequency. So we're going to push in 250 mLs over 3 hours, but every 6 hours we'll start a new bag. Right? infuse 250 mLs intravenous piggyback over 3 hours every 6 hours. Flow rate. So the pharmacy will put the flow rate on the label of any IVs. So you want to round to the nearest ml per hour. And that's all you have to do. Put the mLs and then divide it by the hours. And it even says it. Put the mLs over the hours. So take 250 mLs divided by 3. Round to the nearest ml, what do you get? Yep. So it would be 83 mLs per hour as the flow rate. So the pharmacy will put 83 mLs per hour on the label. U stands for units. In this case, it's going to be units of insulin. Sub Q. What's the verb for under the skin? Inject. So we're going to inject 50 to 60 units under the skin 3 times a day after meals as needed. So if a diabetic's sugar spikes, then they might get some insulin. Inject 50 to 60 units under the skin 3 times a day after meals as needed. All right, very similar to that QS problem. How much to dispense? Here we want our answer in mLs. So the concentration of insulin that we're going to use is 100 units per ml. That's very standard. And the little vials of insulin that doctor dispense, they come in 10 ml vials. So us in class, we will use 100 units per ml, and the vials will be 10 mLs per vial. So in this case, we got 50 to 60 units. What's the most we can use? 60, right? How often in a day? 3 times. So that's 60 times 3 for a total of how many units? 180. But do we want our answer in units? We want our answer in mLs. So all you got to do is take 180 and divide it by 100. So 60 times 3 is 180 units per day. And then just divide it by your supply strength. So what is 180 divided by 100? Yeah, 1.8. So it's already to the nearest tenth of an ml. So all you got to punch in for your answer is 1.8. So you will use 1.8 mLs of insulin in a day. Up to. Drops. So here we got drops to both eyes. So we're going to instill 2 to 3 drops into each eye every 4 hours as needed for pain. So a lot of times after minor eye surgery, patients will come home with a bunch of eye drops, some for pain, some for infection control, some for inflammation. Instill 2 to 3 drops into each eye every 4 hours as needed for pain. All right. How many drops is this patient going to use in a day? So what's more? 2 or 3? 3. How many eyes? 2. So you got to multiply by 2. And then every 4 hours is how many times in a day? 24 divided by 4 is 6 times a day. So you're going to have to do 3 times 2 times 6. So how many is that? 3 times 2 times 6. So that is 36. Yeah, very good. 36 drops in a day. So don't forget, OU is both eyes. 3 times 2 eyes times 6 times a day. 36 drops in a day. All right, for us, we're going to estimate. So in this case, the bottle of eye drops come in a 10 ml bottle. And for us, we're going to use the estimation that every ml will give us 20 drops. So use 36 drops in a day, right? But how many drops are there in the 10 ml bottle? Yeah, 10 mLs at 20 drops per ml. How many drops is that? So 10 times 20 is 200. So we dispense 200, right? So 200 divided by 36 in a day. So the EDS would be, what'd you guys get? 200 divided by 36, 5 point something. So we'll round down to 5. So you got to convert here to drops. 10 mLs times 20 drops per ml, 200 drops. And we figured out they use 36 drops in a day. 200 divided by 36 will give you EDS. All right, not too bad for the hybrid week 2 online A. So this is the only one that didn't have a video. So here in week 2 online B, which covers math, I recorded the previous course session. So after class, just make sure you guys get this done by Saturday. So just like what I did today, everything's recorded. If you haven't, on Monday, completed week 2, day 1, same thing. I recorded a previous course session, and it just covers the SIG codes just like we did today. So this covers it step by step, every question. And they're very similar to today's questions. And then what we'll do is I'll go over math 3. That'll cover Celsius Fahrenheit conversion, order and supply, and then we'll work on week 2, day 2.